Hello everyone, welcome to this introduction to our master's degree in trichology and hair transplantation here in Amir. What we are going to talk about today is a little bit the organization of this master's degree in the international version. We have had many students from different parts of the world, and we found a need, which was to organize the studies in a way that even people from outside of Spain could come and take all of the knowledge and practice as much as they needed, but without having to come and go very frequently. So we did that in the international version of this master's degree. My name is Claudia Bernardez. I'm a dermatologist, and I specialize in trichology and hair transplantation. I have my own clinic here in Madrid where I do both things, and I coordinate the master's degree. We coordinate all the academic and the practical formations. So let's get deep into knowing this master's degree, and any doubt that you might have, you can write it to us on the chat, and I will try and answer all of those questions. So let's see. This is a little bit of a resume of this, the organization of this master's degree. So what are the important points that you need to know? It has 60 ECTS credits. They are accredited by one university here in Madrid, which is called Universidad a Distancia de Madrid, or UDIMA. We do the masters during 8 months because we need you to learn and to get to understand all of the pathologies, all of the ways we work in the surgeries before going into the real surgeries, as we will see. And it starts in May. So we do a type of blended learning, that is that we do part digitally, so from your houses, from your countries, you will be able to see the classes, which are all recorded in in very good quality, and you will have all the notes. I will show you examples, and also we will have meetings that we have online. So while we are just doing the part that is mainly theory, we will be speaking every once in a while, every 2 months or 1 month, depending on what is the information that is being given in that area. And we will answer questions personally, we will see the important parts, and we do this kind of connection. But then we do the hands-on. This is very important, and that is why we combine practical and theoretical learning, because obviously you're doctors, you know that to be able to treat your patients, we first need to know what we are going to treat, how we are going to treat it, and once we know all of that, we can go hands-on and try it. So when we go to the hands-on, we have more than 100 hours of practical training, and that gives our students the opportunity of going back home and using all of this knowledge. And you can start treating your patients with the hair treatments that you will learn, and even try to start those surgeries in your country, or if you already have in your clinic. So we do all of this with a staff that I am very proud of, and that has been growing as we grew the master's degree, and we are all specialists in different areas. So we have dermatologists, we have trichologists, we have hair surgeons, and also specialists in each other area. So we have, for example, an anesthesiologist, because it's very important to understand also how we can do painless treatments and how we do the anesthesia, for example, for the surgery. We also have hair technicians, because we need to learn from them as well what part of the surgery they do and what part is done by the doctors, so that way we can learn really deeply because you see what every person in this type of trichology and hair transplantation does. So let's see a little bit of our method. So as we had said, we have high quality recorded classes, and you have PDF notes that you will have like a whole book. It's actually, if you take it complete, it's like a whole trichology and hair transplantation textbook that we have done associated to the classes. So you will see the classes online, and then you can review with all the texts. And we also have some study support materials. As you know, medicine is continuously changing, so we give you every once in a while updates of different treatments, or maybe just publications that are very important in this area, and we consider that you have to learn them. So for some time that we give you a calendar where it says you will be studying this part of the textbook for the next month, and then we go to a multiple choice evaluation, and we do one for each module, okay? So you will study and then do your small evaluation. It's true that if you want, or for your organization it's better, you can just study everything and then go to a final evaluation, but you have both options, okay? We will be doing that like a small circle, no? Learn, study, and do the evaluation. And then in the international masters, what we do is we almost finish all of these. Wait, I'm going back 1 second. We finish all of that part, and once we've studied everything, we go on to the hands-on practice, because we will use all of our knowledge on those hands-on practices, okay? I will show you in a second how they are. During this whole time, we have, as we said, tutorials, and then some seminars also, apart from giving you publications. If there are important things we need to review, we do that via webinars, or maybe a new technique has come out for like frontal hair transplantation or eyebrow transplantation, and we do a little seminar or webinar on that. And at the end of the masters, you have to do like a small presentation, just like the ones you would do for any medical congress, on some concept or some idea that throughout the masters you consider that you want to learn more in depth. Okay, so that's a little bit our methodology. And this is what you would see in the English online platform. We have the different editions, and you would have to go into yours, and then you see the different modules which we have for different needs of that theoretical learning. We start with an introduction, which is most about learning what is hair, what is hair follicle, how does it work, how do hormones influence it, how does nutrition influence it, okay? We see all of those basic science things that we need to know before doing either trichology or hair transplantation. Then we move on to diseases, to alopecias. This has grown, this module, because in the last 5, 6, 10 years, we have augmented very much our knowledge on alopecia. So now we have a module that is actually very big, and we review almost every type of alopecia, and we continuously update it because the knowledge is being updated. Once you know about all the diseases, we also go into medical treatment and also treatments in the clinics, okay? Because as you know, hair is both medical and aesthetic, so we combine. We have treatments that the patients will just take orally, and we will see them in both modules, but then there are some treatments like PRP or mesotherapy or radiofrequency or some lasers or different apparatus that we use. We will see them in this module on medical treatment. We have a specific module on urgent care and anesthesia, because it's a surgery that many times we don't have an anesthesiologist with us because it's local anesthesia. So we give you all the information so that you know very well how to do it, but also so you can choose whether in your practice you want an anesthesiologist or you don't, okay? But at least you can understand very well. And then we go into the surgery, which we also have a very big module because it's also hair transplantation is the type of surgery that it's growing. And we have more specifications and different implantation methods and different indications. So we will learn all of that with a lot of information. And then we have other modules which are for extra things, but that we know that are important for you during your practice, such as how to organize your practice, how to organize marketing and social media, and communication both for congresses and for social media. So as you see, it's very complete, and we also, within those static information, we have practices. So previous practices that we have done with students, you can also see them. This is a very good example of our downloadable English notes. You will be able to download them and print if you want, and they have many tables, many images, and we go over every detail. So like this one is a module on cosmetic trichology, and we learn of shampoos, how to use them, how to tell our patients how to use them, and that gives you a lot of information. And here we have another example of the part of androgenetic alopecia, which is a very, very important part. I have already gone a little bit over the scientific program, and we are very proud because it's growing with trichology, so we do not miss out on important information. And this is the type of class that you will see. I started with the masters. We started it around 6 years ago, I think. And some of the classes, they are from basic science, so we have them, and then we have many new classes, and you will see all of the PowerPoints, and all of the teachers, all of my team will explain every detail and all of the things. They are completely in English. They have been translated so that you can understand perfectly, and the audio is perfect, and also the main PowerPoints, okay? And this is like our little baby, the hands-on practice, because so we have trichology, which is mainly medical, but it has its techniques that you do in the clinic, that it's growing, because every moment we have more options or more techniques than we can do, and we are constantly adding techniques to our practice so that those students that come from abroad, they can see all of those options, okay, and then decide what they want to do or what they don't want to do. So we start with that medical hair treatments. We do a first day where we review also patient cases, which we think is very important, because as you know, it's not the same to learn about a disease than to really see how we would treat a patient with that disease, taking into consideration their age, their social status, their fears, or their specific clinical presentation, okay? So there's a first day that we do a lot of reviewing of patients and an introduction to hair transplantation, and that way you get a feeling, no, of hairline designs and how we would see donor areas. So we start with just like general information, and then we go deeper and hands-on into the hair transplant. So what we've done, and this is our one of our most valuable assets, is that we have done a progressive training. When I learned, we would learn everything, and then you have to go and try it. But as when you learn any specific technique, we consider that it's very important that you get good or practice a lot one certain thing, and then repeat it, and then practice another one, repeat it, and then combine and use it. So what do? We start with one whole day of donor area. So we start with one whole day of learning extraction from the donor area, and we will do that, as you see here on the image. We do that both on oranges and also on synthetical skin, and maybe in the skin of porks, because that way we get the feeling and we practice and we try to extract those hairs. We review all the theory while we are doing it, and then we get the part of extraction very clear. Then we do another day where we do the recipient area, where we are going to try and implant. We first start just with painting on a specific notebook. Then we do implantation on bananas and also on synthetic skin. That way we review all the theory, we get all the doubts corrected, and then we go to the hair surgery, which is one whole day of hair surgery where the students, I was going to say patients, where the students are the ones that do the surgery. So you are with our team and we go very slowly. We choose small surgeries so that we don't have to go fast, and you will learn, or you will apply all those things you have learned to the real patient. And that is something that our students enjoy a lot, and you get the real feeling of a whole surgery, and that helps a lot. And in the middle, we have an anesthesia and CRP day just to practice also that part of anesthesia, and then we have a final day of party after having worked so hard during the week. So in our edition that is going on now, that started in May, we have this International Week from the 4th to the 11th of November here in Madrid, and in the next edition we will have it in November 2025. So if you're thinking about it, it's a good option to start seeing it, to be able to get there. So this is a little bit the organization of our International Week. We might move some of the techniques just to make sure that you have the best teachers for each technique. And as you see, the main thing is that when we're in the clinic, we will do PRP, mesotherapy, carboxytherapy, radiofrequency. We practice how we would cure the patient after the hair transplant. And we also do lasers and even cosmetology. So we do a lot of things. It's an intense week, so you have only some hours really to go to do tourism, but we have done it from very early in the morning. So in the evenings, you actually have free time that you can also go and know Madrid, which is a wonderful city. So what will you learn in each of the practices of this International Week? The first day, welcome session, we have clinical trichology, which we do the cases, and the pre-transplant consultation, where we learn a little bit of how to understand the hairline of our patients. As we have said, treatments in the clinic, we have many options, and in that day, we even try others. The ones of donor area and recipient area are the ones that you like the most, because you are getting your hands on completely for the surgery, and it's not only to try it, it's actually to practice it. And that's why we have so many hours, because we want you to practice a lot before going to the patient, and also you will take home the skin, the synthetical skin. That way you can keep on practicing at home. We do this also in the implantation, and we do different ways of implanting, which is very important. So we see the use of implanters, we see blades, we see needles, and we try all of the tweezers that we have for the forceps, and we even go over eyebrow transplantation. Okay, so we have many things. In the anesthesia, we go over the main complications that you can have so that you can be able to resolve them if something happens to you, and also with the anatomy. That way you can do the anesthesia better. And then we do in my clinic, which is here down here, the real patient surgery. This is a very fun day. It's long, but it's beautiful because for many it's the first surgery, and we do it completely since the patient comes. We decide what we're going to do, then we do all the extraction of the hair follicles, and then we will do the implantation. We have some lunch during the surgery because it's a surgery that we don't actually stop. We just keep doing, but we have very nice food, Spanish food in the middle. And then the last day, we do a closing ceremony where we give out all your diplomas of those having covered this master's degree satisfactorily, which we are always very happy to do. And also, we can do a final networking. It's very important that you not only learn theory, is that you, from this master's degree, take friends for the future that you are going to work with. And why would you do a master's degree in hair transplantation and trichology? Well, the job opportunities are many, and mainly nowadays, because trichology is growing, both cosmetically and medically and surgically. So what are the main job opportunities that you will have if you do a master's in this hair and scalp health? You can work in your own clinic, you can create it, you can work in someone else's aesthetic clinic or just a medical clinic to do the medical part of trichology, and also you can do hair transplantation either on your own or for others. There are also other job opportunities that are not so thought of, but it's important nowadays with all that it's growing, and that is working for the labs or working for the cosmetic industry or even for the nowadays growing technological industry of hair transplantation. We are having more and more devices that help us do hair transplantation. So those devices will need doctors that are specialized in the area to undergo getting better and having more uses, or even to help them sell them. So we have many, many options we can do. And so if you're interested in our master's degree that we have created, so focused on making you learn the most possible in a short time traveling, but a long time in your house studying and with a lot of information. So if you're interested, you can either write to us, or if you want, you can write now in the chat and we can answer some questions. But you have all of the information and also a phone number if you want to call us and ask anything. So I hope that solved your doubts and that was interesting. Let me see if there are any doubts, and if not, you know that you can write to us, okay? Sí, no sé si sigue grabando.